Good morning, everybody, and welcome back to Sunday Mornings with Mike. My name is Peter Walsh, and I'm the rector of St. Mark's Episcopal Church in New Canaan, Connecticut. Mike Handler, the Emergency Management Director for the town of New Canaan. We're getting pretty good at this. We've done this many, many times, and you know the drill if you've been with us. And if you're new, I ask that we might pause here for a moment of prayer. I'll pray again from my tradition. You would pray from your tradition. If you have no tradition at all, please send good vibes to those in need. Keep watch, dear Lord, with those who work or watch or weep this morning. Give your angels charge over those who sleep. Tend the sick, Lord Christ. Give rest to the weary. Bless the dying. Soothe the suffering. Pity the afflicted. Shield the joyous. And all for your love's sake. Amen. So, Mike, welcome back to your Sunday morning spot. Love having you here. Really grateful that you really make this a part of your life so that we can be responsive to the community that we serve so that they might be in the know.
And it's nice to be back, and as always, I'm here when invited. If the need is not here, let me know, and I'll find other ways to fill my hour.
Absolutely. Maybe do nothing for an hour. That might be good for you. So always sort of start here with the arc of the movement here. You may remember weeks ago now I said that if this were an HBO series, the first season was the coming of the pandemic, the coming of the crisis. Season 2, in my opinion, was Pandemic is Lifestyle. I think we're moving into Season 3. And I've been working on a name for Season 3, and I'm working between the mess or cross currents. That we have a messy movement toward the so-called reopening. Many businesses never close, but a kind of reopening. And there are a lot of cross currents bashing into each other. We have banner headlines in the cover of the New York Times this morning. U.S. deaths near 100,000 and incalculable loss, and a very poignant little piece written about that. The Sunday Review had the large front page, no one knows what is going to happen. At the same time, we have Memorial Day weekend, the opening of the beaches. We've had phase 1, restaurants. And in the midst of all that, on the town call the other day, there was a lively conversation about, would you wear your mask downtown? A conversation I'm sure you were delighted to miss. Anyway, so let's start with something that the local folks would like to know. How did the kickoff go?
Of the reopening?
Yeah.
So from my perspective, it went well. I think this period of chaos is to be expected. I think I mentioned before, we're always going to be in a point where people think we're either moving too fast or too slow. Very seldomly do we get it perfectly spot on. But I think from what we've witnessed, I think people are being respectful. I think by and large people are wearing masks, they're socially distancing. I think we are moving towards reopening a lot more than people anticipated, I think, at this point in time. Good. Again, some want more. It's never going to be perfect. The restaurants, I'll tell you, the challenge with the restaurants is, as much as we want to invite outdoor dining, in some cases you might be doing more harm than good because you're giving up the ease of curbside pickup. So, as much as we want to give out, more seating for outdoor seating and dining, it's great for us, but you could be giving up, 200 meals by curbside to get 10 tables outside. Ooh. So what we're hoping to do is to work with our restaurants and our retailers to make sure that it's working. If it isn't, we'll adjust. But no one's gone through this before, so we want to make sure again that every action that we take doesn't have a negative reaction that we didn't quite take into account. So, but I think it's gone fairly well. I think the field's opening up. I think Spencer's Run opening up. I think there are a lot of things that we're doing that kind of get people back in. It's never going to be 100%. But I'll tell you, the biggest thing for me is the testing. So I certainly think come June 20th, we're working towards almost as much of a reopening as we're going to see for the foreseeable future. I don't know if we'll still have large-scale gatherings and events, but absent the Super Bowl or absent 4th of July fireworks, I think we'll get a lot of things back. It's only going to work if we have ample testing and adequate testing. So that's kind of where 100% of our focus has been this last week and a half. And we've been working on it really for months, but we're actually implementing it now. So if we can take just a moment and talk about what's coming. I mentioned before that we're going to do a comprehensive test, both a diagnostic PCR test and an IgG antibody test. And we rolled it out, we're going to do our third day on Tuesday, and we rolled it out deliberately to our first responders first, and we can talk about the results we got on that. Of the 320 first responders, town employees, and their immediate families that they're quarantining with, we haven't found a single positive PCR test result, which is great news. We're testing symptomatic and asymptomatic people now. So if you're symptomatic, obviously, you probably would have gone to a doctor to get tested before this date. But we didn't find any positive asymptomatic people, which is good. We also tested for antibodies. And I think what we've discovered is those who we thought would be most exposed to the virus because they were actually treating those who were infected came back around 4% with positive antibodies. So what that means is, it's great news, and it's my hat's off to our first responders for the way they use their personal protective equipment.
Right.
It demonstrates that you're not truly exposed if you're properly protected. So that's the good news, and it looks like all of our first responders took that to heart and really took their training to heart, and I give their chiefs and their command staff a lot of credit for really making sure that was driven home hard, and it kept a lot of our people safe. But you would have thought before this that the first responders would have had the highest rate of antibodies, because again, they were actively involved in treating patients that were positive. So we're going to move, because of those results, rather than open it up to the broad public immediately, we're going to open it up first to our service workers in town, which is interesting because they don't all live in town. Most of our first responders don't live in town. But we're going to be testing, hopefully, all of our retail, restaurants, service workers for two reasons. Number one, if they're positive for PCR, they're going to be in contact with a lot of people over the next couple of weeks. So getting them to isolate is probably even more valuable. But also from the antibody perspective, we'll get a sense of how much exposure they've had and how much immunity they may or may not have. And keep in mind that it doesn't mean that if you have a high titer of antibodies that you're necessarily going to be immune for any period of time. We're still waiting on that guidance from the federal government. But right now, we are a little surprised that the first responder community was only about 4% positive for antibodies. So that'll probably take 2 or 3 days to get through the service workers. And then beyond that, we'll open it up to the public. And I think it's important to note that we can do about 160 tests a day. Again, it's a nasal or a throat swab. And that question came up last week, Jill. I wanted to mention the thought process behind doing one or the other. It's not necessarily what's more pleasant. It's really about what equipment we have available to do the analysis, as well as what swabs we have to do the testing. So by and large, most people would expect a nasopharyngeal swab, but we do have some capacity to get tests in at Stanford Hospital that are throat cultures, and when we can, we'll do that. So I don't want to set people up for under promise and over deliver, as what my hope is here. So we're going to have a nasal swab and a blood draw, and if you happen to be fortunate enough to get a throat swab, then you hit the Powerball. It's not necessarily dramatically different, but that's the way testing is going to work. We get 160 to 180 in a day, and results come back within 3 to 4 days. And what we're hoping to do is put up a rolling kind of average of where we are in town. Once we get through the service workers, we'll open it up. It'll be an online application. The only thing you'll need is to provide your primary care physician. It's interesting. I'm going to add something to the charts and the application that we didn't have before, and that is blood typing. So we're not going to do blood typing, but we're going to ask people when they sign up to indicate what their blood type is if they know it. If they don't know it, then we're not asking people to guess what their blood type might be. But if you know it, we'd like to see it. And the reason is because there's some evidence that hasn't really been borne out yet by data that suggests that if you're O positive, you have less of a likelihood of contracting the virus than if you're A. And again, no one's actually done the study to see if it actually works, but we're going to have a number of people going through this study that might be valuable. So that's kind of where we are on testing. And it's the only way we'll know if we can catch positive PCR tests early from people that are asymptomatic. Keep in mind the 4% positive for antibodies is good that we protected our population, but it also means that one asymptomatic spreader in the community can wreak havoc. So we have to really be careful and wear masks because, again, one person that is positive, if there's no immunity in the community, can actually wreak havoc.
Wow, it's good. So much there, so much there. Let's unpack it just piece by piece
Sure.
here. For me and for Jill and for everybody here in TV land, let's just slow this down. So someone signs up online. Where do they go? How do they get the response back? Does it get emailed to them? If you're doing 160 a day, there's 20 or 22,000 people in town, what does that look like? We had also talked about you need to be able to test through time and over time in order to know. So
we're going to do the testing every 3 minutes. It's going to start on Tuesday for town service workers, and then it's going to move towards the general public. So my sense is we'll know today or tomorrow who signed up from the service industry. And if that fills all of Tuesday or all of Tuesday and Wednesday, we'll start the public just after that. We're going to open up the testing, and we haven't nailed down all the details yet, but my sense is we're going to open up kind of 2-day window for signups. And you'll get an email from me saying, here's the link to go sign up online. It's a fillable form. And you'll see time slots, we'll have 3 testers every 3 minutes, and they will fill up. And when that fills up, we'll open up the next 2 days. So we're not going to open up a month's worth of test slots because you'll have some days where no one shows up and days where there's too many people showing up. So we'll do just 2 or 3 days at a time. Everyone that wants to get tested can get tested. Those who are uninsured, we will find ways of getting you tested with government funds. So everybody is entitled to get tested whether they have insurance or not. As far as results going back to you, we're going to ask on the sign-up form that you check a box that indicates that you're okay with us emailing your results to you, to the email address that's on the form. That is our way of asking if we have permission to not go through your primary care physician. If you don't want us emailing the results to a non-secure email server, then you have to list your primary care physician, who will then get the results the normal way and get it to you afterwards. It'll take a little bit longer, but our hope is that most people let us email the results back to them.
And that's quite an assembly line that you're envisioning. Where does the assembly line take place? What does a person actually do? I mean, they've signed up online, they've got their slot, then what happens?
So I'm not going to give you the location of where we're doing the testing yet, because we'll have people lining up today for testing on Wednesday. So we'll send out the address of where we're doing it. We've done this now for 320 people, so we've kind of worked through the kinks with our own internal first responders, which was part of the design to understand how it's going to work. But you will essentially get a 3-minute in 8:03 or 9:03 in the morning, pick a time. You'll show up 5 minutes before your appointment. You will have applied online. If there's any application questions that are omitted, we'll send you an email back asking you to fill in the balance of the application. You'll show up with your driver's license and your health insurance card. You'll get checked in. You'll immediately go right to a nasal swab, and then right to a blood draw, and out the back door into your car. And again, I did it. I went through it. Pretty seamless, professional. We're doing this with Stanford Hospital, so we did that for a reason. They have the capability of doing the testing that has the highest rate of successful results in terms of not having false positives and false negatives. So some of the things that we learned over the last couple of months are invaluable. So the first testing we did in town was just a nasal swab, and that swab was the sample was taken, it was put into a transport medium, it was cold packed and shipped to California. Either LabCorp or requested the analysis. It took 12 days to get results back. What they're finding is that equipment, and there's a lot of stuff in the press about this currently, about the Abbott Labs ID Now test and is it accurate. And what they found is that the transport medium is where a lot of the false positives and false negatives were coming from. So what we're doing differently is we're not using any transport medium. We're taking the nasal swabs and we're messaging them back every hour back to Stanford Hospital to run the tests immediately, or put them in a refrigerator where they can stay without being in a transport medium. So we're bypassing the step that created the false positives. So, and actually we've seen some evidence of this. We've had somebody in town that tested positive and didn't have antibodies, which makes me wonder if that first positive was really a true positive or not.
So I want to slow that down again. Someone in town tested positive and they previously had thought to have antibodies.
Yes, so we had somebody in town that did test positive through a PCR nasal swab where it was packaged in a transport medium and sent off. And turns out they came back without antibodies. So in looking at it again, and we've got doctors that are looking through this, it's very possible there was a false positive on the initial PCR. This person was isolated for 14 days and then went back to work, but at the end of the day, better safe than sorry, but there are some problems with the testing. As we move through this, it's going to get a little bit better. And you're right. So you said 22,000. If you take into account all of our service workers and employees, it's probably pretty close to that number. We're not going to stop this on a certain date. So if people want to continue to get tested, we'll go as long as we need to. I'm envisioning we'll have testing here for a couple months, and we'll stop it when the demand isn't there.
Okay, thank you. Jill, is there any questions about the testing? Before, we can switch gears. I didn't know if there was any questions since we're on the testing topic, which is such a big topic to our life here.
Yeah, Mike actually proactively answered some of the questions that I had. There definitely were people who were wondering now that the restaurants are open, and also since people have been having takeout, about the service workers. So that is great news. And I think you touched on this, but just want to make sure this person gets an answer. So can you just say something about with the antibody tests, is there anything that can be inferred based on the level of antibodies about the level of protection?
So the testing that we're doing detects neutralizing antibodies from 0.01 up to some whole number. 1.4 is the cutoff that we're using to determine if you have a positive IgG antibody test. So I tested at 0.02 or one of the lowest levels you can have, which means I'm pure as a driven snow, which isn't surprising because I really pretty much stayed home the entire time except seeing the two of you. So we have people that are testing at 6, right? So obviously they've had high exposure. Part of the study that we're doing as part of this investigation and testing is whether or not you've been tested previously, were positive or negative, or if you were sick. So you would assume that if somebody that, I'm curious to see if people that were positive in the past come back and show high levels of antibodies. I'll tell you something that is interesting, Jill, which is we have families, we're not just testing first responders, we test our first responders and our immediate family. So I showed up with my wife and my oldest daughter. And so anyone over the age of 10 can get tested. The interesting thing is our experience throughout this entire pandemic thus far has been that if there's one person that is actually actively sick with the virus, the entire house generally gets it. And we've seen tragic stories where one person gets it, recovers, but someone else in the family gets it and does not recover. But what's really shocking is we've got families, nuclear families that live together where there's high levels of antibodies in 3 of the people, and one person has no antibodies. And I can't explain how that happens. The doctors can't explain how that happens. It's just, it is what it is. So I suspect a lot of the information we're getting right now will actively help us manage isolating people that are positive and, think about the uses that we can have in the future. So first and foremost, if you're positive on a PCR test, we'll isolate you and your contacts for the last couple of days, and that will help keep the spread down in the community. But from an antibody perspective, think about how we can use this. So if we determine first responders have high levels of antibodies, we might use PPE differently. If the CDC comes out and says if you have a neutralizing antibody titer of 4 or higher, that you're essentially immune for a year, or 2 years, or 3 years, we might be able to change the way we operate on a daily basis, which could be very beneficial if we get into another peak at some point. But also, service workers, right? So the testing we're doing is not just to protect all of us going to the restaurants. It's also to protect the people that work in the restaurants. If they have no antibodies, they know they're going to be in contact with hundreds of people a day. They need to be that much more careful, wear masks, and wash hands. The takeaway from the 4% results we've gotten thus far isn't that we're all immune and we're all good. It's really that we have to really pay attention. And you don't know who is positive. So we're testing our community. We're testing beyond our community. But nothing's to stop, if you have a movie theater full of people, 50 can come in from out of state or out of town that just don't have the same protocols we have of testing. And again, with low antibodies in the community, one positive person can wreak havoc. So that's why we just got to be thoughtful in how we do it. There's a lot of information I suspect we're going to learn from this as the months go on. We may not know it today, but we'll have the data and we'll be able to look back and see what we can glean from it.
Well, thank you. That's really, really interesting. Amazing to me, we have the best minds in the world working on all this, that we really don't know the virus particularly well. And people who are saying they can predict exactly how this is all going to unfold, and others, the experts saying we need to have a particular humility before this novel virus that we do not know. Jill, I want to come back again. Anything else on the testing before we move on from testing, or just want to get those questions all in one zone?
Yeah, let me just, okay, yes, this literally just came in. So there have been some rumors circulating that antibody tests require you to waive your HIPAA rights, leading some to say they won't go for testing. Can you comment on that?
Yeah, so you're certainly welcome to get tested without waiving your HIPAA rights. We would just have to take your primary care physician's information, do the test, and relay it through your primary care physician. What they're probably referring to is the fact that this is a reportable illness. So if you're PCR positive, it is reportable, like other reportable illnesses. So the State Department of Public Health will get the results if you're positive for the PCR. So that might be what they're talking about. So there's certainly many other communicable diseases that you may have that we're required to report to the state.
Is it measles or
So
polio?
I don't want to name, I don't know which ones specifically are actually reportable, but there are plenty. There are plenty of respiratory illnesses that you have an obligation to report to the state that are highly contagious. So I don't know which ones are, which ones aren't, so I don't want to guess, but there are others.
Okay, good.
And our director of health is the one in all those cases in town. So as we have any one of those reportable illnesses in town, they're required to actually monitor and make sure that they are following the precautions and procedures that they're responsible for.
And speaking of the, people's concerns, maybe inhibiting them from getting tested or doing other things, is there have been a lot of headlines about maybe worrisome drops in regular vaccinations.
This came up in my household, actually. We've got a 1-year-old who's due for vaccinations right now. And the question is, do you bring your child to the doctor's office to get a vaccine when you know that taking him out of the house and going to the doctor's office, again, not large exposure, but runs the risk of exposure? It's no different than any concern I've ever had in the past about well visits, right? So you go to the doctor for a well visit, but when you walk in, there's all these kids that are not feeling well and they're sick. We somehow managed to get through that. So I think early on in this, I think it was prudent where we did not go to get vaccinations, but I don't think there's any reason why I would avoid getting vaccinated now. There's precautions you would take. I wouldn't let my kid go play with the toys and put them in their mouths, but I would, bring them in, get them vaccinated, and take them out, and I think it's perfectly fine. Individual choice, though.
So thank you for that, and I'd also read that. That's such a great question. So testing, that was one of the pieces we needed in order to build back some semblance of normalcy in our life. Second piece that we've talked about, the building back, is tracing. I wonder if you might have a word about, is our community prepared to, now that we're doing all this testing, certainly we're going to find more positives, and do we have an infrastructure to trace, and how far do they trace back, and how does that all work?
So we do have the infrastructure in place, and New Canaan's utilizing our school nurses to help with contact tracing, which is a resource we have in town. And again, I can't say it enough. If I go back my 20 years in town, or even just 11 years in this position in town, every time we've had a disaster or a crisis in town, what we thought was a crisis at the time was more of an inconvenience. The schools historically had been a larger drain on the community, our resources, than support. And I can tell you without any doubt in my mind, over the last couple of years, that has totally flipped around. And under Dr. Lutz's leadership, the schools are actually the best resource we have, one of the best resources we have in town. So we have a problem. They're never the problem. They're usually part of the solution, which is remarkable. So this is no different. Yeah. Rather than using brand new contact tracers from the state that are pretty much interns that were brought on, given a 30-minute online class, we're using strong public health advocates who know the community, understand what they're dealing with, and they're our school nurses. So that's been reassuring to me and to Jen Eielson, our health director. So contact tracing is interesting, and I hesitate to say this on camera, but the fact of the matter is contact tracing is voluntary, right? So one of the challenges, I say that hesitantly because I don't want to give people any ideas that they don't have to participate in contact tracing. But if you test positive and you're sick, we have an obligation to make sure that everybody that you've been in touch with for the last 3 days, depending on when we test you and when you test positive, to get them to understand they've got to isolate as well. And I will tell you that we can call you up and ask you where you've been, and you can tell us we're not telling you. We cannot be truthful. We saw a lot of not being truthful early on. We saw a lot of people that said they never left their house. And then we found another positive, and they acknowledged they were with somebody that said they were never left their house. So no one's going to be 100% honest. But let's talk about why you should be. for this to work and for us to get to a point where we're using our community and getting out and doing the things we want to do, opening schools, doing things that we all rely on, it really does require our ability to contact trace and isolate effectively. If we don't, our low immunity levels are going to end up, having serious problems come the fall. So if we can't get into a place where we take care of each other by being honest and forthcoming about who we've been with and isolating, then it's just a complete wild, wild west, and I suspect we'll head down a path of closing things down again in the future, which would be really unfortunate. So my sense is we have a responsible community. Most people are doing the right thing, but contact tracing is voluntary. We rely, like everything else, on people doing the right thing and being honest with us. And again, no one wants to have this level of scrutiny and oversight of what they're doing, but we open up offices, and offices are required to not have group gatherings of more than 5 people, and offices are required to keep logs of who their employees are in contact with. The reason is because we want to make sure that if someone tests positive, we can go back and look at paper trail of who you've been with, so we can tell you those people need to isolate. That's the only way we can do this. Otherwise, everyone gets quarantined again, which is most unfortunate.
And so just touching on that office log, that's if you're going to the office.
Correct.
Right.
Correct.
And then, and that would work if you go, and that would work figure out how to be businesses without going to the office. And then you have, of course, somebody who works at Acme, and there's no contact tracing through there. It's everybody who got a gallon of milk.
But that's why we're going to great lengths to test those people that aren't largely not New Canaan residents. A portion of them, unfortunately, will be uninsured, but the town thinks it's a priority to make sure that gets done, and we're willing to do it.
Great. Jill?
I'm reading as fast. Now they're coming in, right? A perennial question. Is it safe to have our cleaning people start coming back?
Again, these are all personal choices. I can only speak for us. We have not. I think it's all about risk reward, right? So I do think if people are cleaning multiple homes and in touch with multiple people, that just increases the risk. But again, I suspect in the next 30 days, things are going to open up more broadly, and all that stuff is going to be back on the table. I don't want to get into a conversation as to what the state is allowing or not allowing to open up, because it really is kind of random at times. There are things that I can explain and things that I just absolutely cannot explain. So I think we just have to appreciate that there's a rolling kind of measured approach to how we're going to open things up, because if you open it all up, you don't know what's actually causing the impact. So I think doing it on a 30-day window gives us a chance to see if there's any spike in cases, and thus far we haven't seen it. We're still getting new cases, but not to the level that we've seen before.
So, I've read these
now
that the opening up doesn't mean that the virus is gone, less dangerous, less virulent. It just means that we're trying to balance the risks.
So I think it's a true statement that the virus is not gone. I think what it has done is given us a comfortable 2-month window to where if you had it and you were able to spread it, you pretty much stayed home. You survived it. Unfortunately, some of our community have not survived it, and that's very sad, but I think it's given the virus a chance to run its course in certain people without spreading rapidly. And it also gave us a chance to create enormous capacity in our hospitals. So that was the whole goal of that first day we were here talking about flattening the curve. So we've done that. And I think we as healthcare professionals and first responders understand now how better to respond to this. So if and when we get, God forbid, we get to another wave of this, I think we have a better framework of how to handle it, how to address it. And again, we were literally learning while we were going last time, and that's never a comfortable position to be in. So is the virus gone? Absolutely not. Is it perfectly safe? Absolutely not. But I do think with some appropriate protections, and again, they aren't expensive, they aren't complicated, wash your hands and wear a mask, we should be able to keep this at bay. If we don't wash our hands and wear a mask, then there's no doubt there'll be more spread of the virus and people getting sick and dying. So that's the whole idea behind this.
Joe, I want to hang there 1 second. Wash your hands, wear your mask, wash your hands. Was what we touched on before we started running live. What do you do with your gallon of milk? Do you wipe it down? What do you do with all that stuff that's sitting on your porch? You know, those boxes and your mail, and just comment about that.
Sure. So there's a lot of talk that's happening in the media with respect to hard surfaces, cleaning, not cleaning. I personally view this as kind of, again, a novel virus where we're learning, and I don't think we have definitive answers on much of anything at this point, other than ventilators, very, very bad outcomes. That's the only thing we really pretty much tangibly learned throughout this entire process. So I think it's still prudent to actually take precautions, again, that are not life-altering and really draining of one's family resources, but wiping down things before they come in the house seems like a reasonable thing to do. But again, it's personal risk. It's how much risk you want to take. Should you wipe down your gallon of milk when you come home from a party of 50 people that are, having a party? Probably not. You're exposed to that risk by going to the party. If you are still trying to be mindful of not approaching groups of people and trying to wear masks, then by all means, I'd wipe down your stuff coming into the house.
What about wearing gloves? So someone writes, I haven't heard anything about that lately. It used to be on the list, on that short list, and nobody seems to be wearing them anymore.
So here's the thing with gloves, and it's the same as masks, unfortunately. These are pretty simple things to wear. It's not all that complicated, unless you actually come in contact with someone who's got the virus and it's droplet spread and it's on your mask, right? So we take these masks off and put them on again, take them off, put them on again, take them off, put them on. I suspect the reason why our healthcare professionals and our first responders did not have enormous antibodies is because they really know how to put equipment on and take it off. And that is not something that is just learned overnight. So the problem with gloves are, and if you don't put gloves on properly or take them off, you're defeating the entire purpose. So, and again, the goal of this is not to deplete the healthcare industry of resources they need. So the reason why you're not wearing N95s is because we still don't have enough for our healthcare professionals. So washing your hands is just as effective as wearing gloves. If you know how to wear gloves, then by all means feel free. I do, and occasionally when I go out and pick up to go, I will wear a glove. They take the food off the table, bring it home, we'll wipe it down, I'll take my glove off, and we're done. But again, it's how much risk you're willing to take. If you live your life, and again, no one needs to be paranoid and neurotic about this. We're at a point now where we understand a little bit more about the virus. If we understand that washing your hands and limiting social distancing and wearing a mask is as good as you're going to do, then I think you're going to be able to sleep at night knowing you're doing your share. Remember, the mask isn't just for you, it's really for the people that you're coming in contact with. So it's not all that complicated. I mean, we're spending a lot of time talking about something that's really pretty basic.
So, with the gloves, I used to be a certified food handler, so I used to know something about that. And that if you're wearing gloves, but then you touch something contaminated and then touch something else, no difference whether you have the gloves on or not.
That's right.
Right? So if you touch something contaminated, take your gloves off, or you touch something contaminated and wash your hands, the result is the same.
Correct. And truthfully, if you're wearing gloves properly, you're supposed to wash your hands with your gloves on and wash when you take them off. So it's not really doing a whole lot in terms of saving you from washing your hands.
I just have a follow-up related to the reportable diseases, which I think is helpful and might be helpful for people to hear. Among the list of reportable diseases is Lyme disease.
Tuberculosis also.
Tuberculosis. I mean, obviously, the things you would think of, HIV, but also, and hepatitis and things like that, but also even things as simple as Lyme disease. So I would say in this part of the world, people get tested for Lyme disease all the time and don't think twice about it, and don't worry, about any kind of invasion of privacy. So maybe that helps people think about this test.
I also hope there's no stigma associated with having antibodies to the novel coronavirus. I think it's certainly on everybody's mind right now. I think I'm seeing the opposite. I think people are disappointed. I can speak for my own family. We've isolated and quarantined pretty ugly from the very beginning. But I can tell you, I think I've said this to you before, December, January, we were sick as a family. We were getting flu tests, flu A, flu B, strep, because kids were sick, we were sick. And I think deep in our minds, we thought we probably were exposed and didn't know we had it. And again, my wife and I were kind of surprised that we didn't have it. But again, we're not meaning to infringe on people's privacy, but this is one where you test positive on the PCR side. No matter how you get tested positive, you're going to get results to the Department of Public Health. whatever we put out publicly is going to be blind. So the data we'll put up online will just be numbers and statistics. It will not be identifying, certainly.
So I wonder if you might just, did you take a drive down, excuse me, Elm Street on Friday night?
I did
Take
not.
a look at it?
I did not.
What do you know about it? What does it look like? What is it? I'm a sort of stay-at-home guy. Tables out on the sidewalk? I mean, do they have plastic separators? Your server comes out with a mask. You've got a mask on. You'd say you'd like a hamburger, and you chat, and then you take your mask off for your hamburger. And is this what's happening
That's
here?
the way it's supposed to work. The changes at the restaurants that were mandated by the state were outdoor dining only, no more than half of your capacity. Paper menus, disposable menus, you're not sharing.
Right.
Utensils that are not, they're being wrapped before they put on the table. Masks are required. Your server will be wearing masks. I think some will be wearing gloves or washing their hands frequently. Yes, you're supposed to be wearing a mask, taking it down to eat, and putting it back up after you eat. The only two exceptions in the governor's guidance for masks coming down are when you're actually feeding yourself at an outdoor restaurant, or in your office. If you're in your private office or your private cubicle with no one else 6 feet around, you can take your mask down to work. Those are the only two exceptions that he's had in his guidance thus far.
Yeah. So the governor's been busy. Holy smokes. And his task force, and I've seen a little bit of the online presentations and phase 1, phase 2. Phase 2, as you were saying earlier, looks toward a much looser reopening, including things like youth sports, summer camps, public library, gyms, non-residential places. I mean, the list is quite long. Official list out of the governor's office: movie theaters, bowling alleys. Any comment about any of that?
Just that I suspect if we are mindful right now, I think June 20th we'll see a larger return to what we're looking for. I think you'll get a little bit of everything that you're trying to get back, with the exception of really large gatherings at, event stadiums and things like that.
So I'm seeing, phase 3 includes bars and outdoor events up to 100 people. Kind of interesting. I also know I had the opportunity to interview Chris Russo, Mad Dog Russo,
Sure.
The other day, and really fun to talk about sports opening. And I know that the Buckeye Stadium in Ohio, which holds 120,000 people, which if you think about it, is crazy, right?
Yep.
But they're trying to figure out how to put 20,000 people in the Buckeye Stadium. A lot of other states are moving toward things at a different rate than Connecticut. Any comment about the higgledy-piggledy approach to this that we're seeing?
So I think it's unfortunate that a lack of a federal response has pretty much opened this up to each state, each region, each town having different approaches to how they're going to handle things. I think in some cases it's warranted because different parts of the country were hit differently, so that's kind of understandable. As far as the sports go, I've seen now 2 plans for large stadiums to reopen at a fraction. We're talking, 12% of their seating capacity and what it looks like, and it looks ridiculous. It really does. I think the NBA playing at Disney exclusively without fans is going to change things for a little while, but hopefully we get through October. Hopefully we get a vaccine within the next year and a half, 2 years, and then things can kind of get back to some semblance of normalcy. But again, we've got to take it one step at a time. And I don't want to go back to this over and over again, but you have to. The only way we're going to get through this is by being able to test and isolate those who are positive. Otherwise, we'll see a spike in cases that we just don't want to tolerate.
So when I was saying that the HBO series was either Cross Currents or The Mess or Risk Reward, something in there, we have one of these cross currents is it's Memorial Day weekend. I want to go outside. I want to do something fun. I want to go to the beach. I want to go to my beach house. I want to go here. And I hear the news that the people of Montauk are closing off their parking lots, so people like the Walshes don't drive in and say, I love Montauk. And so we have all this. I want people to come to Lake George for ice cream, but I don't want you to come to my town and bring me your COVID. Any thoughts about like this?
So the whole cross-current theme for your HBO series, I view as good news. So if you understand crisis, like this is exactly what we're supposed to be going through. It's not like this was not predicted. I think if you go back a month and a half, 2 months ago, any good emergency manager, anybody who ever sets up a shelter, which is one of the hardest things to do in emergency management, the very first thing you do after you open the shelter is you plan out how you're going to close your shelter, because it drains every resource you have. So it's like a boat, right? They say you buy a boat and the first thing you do is take a picture of it, so when you go to sell your boat, you have a picture that looks new. But you always want to get yourself out of a crisis. So professionals that do this all the time kind of understand the stages of where you're going and kind of how to get out of it. So it's not like we didn't anticipate this 100% of the population being unhappy because we're moving either too fast or too slow. This is very healthy. I think we're doing this in a good way. We don't take it personally. I get a lot of emails, a lot of calls saying so-and-so's, Billy's out riding a bike without a mask on. And then I get so-and-so, call because they complained that Billy wasn't wearing a mask. It's like, this is what you have to go through, kind of learning, growing pains to get to the next step. So it's not a surprise to me that some communities don't want tourists to come, yet they're complaining that their economies, it's 90% based on tourism, is not thriving. That's the growing pains of what we're going through. What we just went through as a community and as a country or as a world is wholly unnatural, right? You have to understand, this is not something that we're ever wired to do. Right. So coming out of it is never going to be an easy process. Yeah. So, you have to look back on what we just did. We shut the world down for 2 months. Never been done before. Largely never been tried, never been experienced, and no one knows what the impact of that's going to be, both financially, from a health perspective, but also psychologically. So I expect this to be chaotic. And I think as people get more confidence that things are going to work, they'll be able to enjoy things a little bit more. I think as Montauk, the residents of Montauk realize that, they need the tourism. The beach is nice, but without people paying the bills, they don't get the tax revenue, their taxes go up. They're going to realize that they got to start opening up their economy a little bit. It's going to take a little bit of time. The important thing is to just be honest with the facts, provide whatever support you can as a emergency management or first responders and town government, and let people get confident that you're doing the right thing. And eventually this stuff is going to come back.
Yeah. I want to, in the waning minutes, do you have a question, Jill, that you want to get into before I
do. I have a couple all in the same vein, in line with the governor's comments about community facilities and educational facilities. Is the town advising private clubs like the Field Club and Country Club of New Canaan about this reopening, and what about the Waveney Pool and fields, and can you comment on that?
Sure. Throughout this entire process, we've had a remarkable collaborative experience with both our private schools following our public schools, with our private clubs following our town parks and pools. So the governor has not given any guidance on pools yet, and pools are not allowed to open. However, town pools are. So municipal government was exempt from all the rules because it was deemed essential. Why a town pool is considered essential, I don't understand. But we haven't worked ourselves through this whole process of not just the pool, and I don't want to get a lot of emails about the value of chlorine in a pool and how that mitigates the virus. We get all that. It's the changing rooms and everything else that's associated with the pool that's very tough to manage. So we are going to wait as a town until we get through and see what the state guidance is on the private pools. So again, we've had, there's a lot of conflict in town. Private schools versus public schools, town tennis versus private tennis, town paddle versus private tennis. And throughout this entire process, my goal was to provide a consistent message. So I did not want to see, the private clubs paddle tennis courts shut down by us, and yet the town paddle tennis courts be open. It gives very bad mixed messages. So we just kind of kept them all consistent. So despite the fact that I think we have the ability to open our town pool, we are not going to do it until we get the guidance or the science that tells us what the risks are and if it's worthwhile to do.
Really interesting about the question of science and water. In our little world here, there was all sort of movement that if we were going to baptize somebody in water, in more than one, we had to replace the water in between. That many churches have so-called holy water upon entry, and that was all to be taken away. And right. Now when is that water bowl big enough that you don't need to replace it, kind of thing. But really interesting. So
can I give one tip?
Sure.
I'd be remiss if I didn't mention Spencer's Run. So we did open the dog park, and I want to give people a tip, and I think people are smart enough to figure this out. The risk with the dog park wasn't necessarily that dogs couldn't keep 6-foot social distancing, because they can't. The risks with the dog park were if the dogs all congregate, the people would all congregate, but that's not really the only risk. To get into Spencer's Run, you need to punch in a code to get into the gate, and that was a point of contamination. So I don't want to get into the CDC recent guidance of heart surfaces not being a source of contamination. How about you just take the dog bag you're using to pick up after your dog, use that as a barrier to punch the code and go in the gate that way. So those who are using Spencer's Run, it's a very cheap and easy way to get into the park without actually having to touch the metal buttons. So I just want to throw that out there. I'm sorry.
Oh, no, not hardly. These are the sorts of practical things that are really helpful to us as a community as we all begin to move forward and open up. Okay, so you're an emergency management director. You trained for this?
No one's ever trained for this.
This is learn on the job.
So, yeah, and I can tell you some stories about people that I thought were trained for this that said they weren't trained for this. No one in this line of work has trained for this type of a response. Everything we've done in training is considered all hazards training. So it's not just an active shooter, it's an active threat. It's not just a hurricane, it could be a tornado, an earthquake. But this has tested all of us. And again, if it sounds like we're learning on the fly, it's because we're learning on the fly.
Well, I'm actually really encouraged by that. I mean, we were mentioning earlier last night at the Walsh household trying to pick a movie, and kid 4, Gus, wanted to watch Contagion, and I was like, oh, I don't want to watch Contagion. I'm trying to get away from Contagion. I don't want to watch it. And now we're all living Contagion. But I do want to finish as the bell tolls again to say thank you to you and to the town team. Thanks to everybody for giving us the old college try as we move forward. There is no doubt that of things that we can do, it's not only to wear a mask, it is also to constantly give our neighbors the benefit of the doubt with a bit of kindness as emotions run high over all of these things. There's no doubt. You'd asked me last week why some people don't wear masks, and this is why some do, and I just said it's hard to get people to all do the same thing. But I do believe that the appeal to the common good, and ultimately from our perspective, it's all about love. That's it. That's the whole meaning of life. I've been to a lot of funerals, and the only thing that anybody cares about is love. And if people see this whole movement as an act of love, we're heading the right direction as a community, a small community and a large community.
Agreed.
Yeah. So peace and gratefulness to you, to your household. We'll see you here next week as we continue to unfold along with the good people of our town, what's going on. So
you promised to tell me when the demand for this wanes.
Okay,
right?
When these people don't want to listen to you, we're going to move on. Okay, this is all about them. So okay, take care. Thank you.